Okay, now we're going to talk about antidepressants. There are several different categories here that we're going to talk about. We have tricyclic antidepressants, SSRIs, SNRIs, miscellaneous drugs, which is also kind of under SNRIs, and MAOIs. So lots of letters, lots of categories, but they're all going to be kind of doing similar things. So antidepressants are indicated for people who have depression, bipolar disorder, obesity, eating disorders, OCD or obsessive compulsive disorder, panic attacks, social anxiety, PTSD, premenstrual dysphoric disorder, and alcoholism. So there's a whole lot of things that this can treat, and we have several different categories. So the first category that we're going to talk about is tricyclic antidepressants. The drug in particular is amitriptyline, which is Elavil. That's how you spell it. It's for insomnia and neuropathic pain, as well as other things over here. Adverse effects of amitriptyline include dry mouth, constipation, blurred vision, urinary retention, sexual dysfunction, gynecomastia, which is the development of breast in men, hypotension, seizures, and weight changes. Not these effects in particular, but like positive effects and possibly adverse effects of these drugs will take up to 4 to 6 weeks to show. And there's an overdose is possible, but there's no specific antidote. People in the emergency room or a doctor would just give activated charcoal to the patient to help absorb the remainder of the drug in the body. The next category we're going to talk about are MAOIs. The drug in particular is Spinoza, which is Nardil. That's how you spell it. Dopamine, serotonin, and norepinephrine are not broken down when this drug is given. Adverse effects include orthostatic hypotension, dyskinesia, dizziness, nausea, and syncope. This drug in particular, in the MAOIs, patients are not supposed to have tyramine, including foods. So foods that have tyramine inside of them. This includes aged cheeses, smoked meats, red wine, fava beans, and yeast. This can lead to a hypertensive crisis. So remember, MAOIs, no tyramine foods, or tyramine foods, however you say it. I think it's tyramine. The next section we're going to talk about are SSRIs. For SSRIs, it's going to take about 4 to 6 weeks for it to reach maximum effectiveness. There are 5 right here that we're going to we're just going to mention because there's not really much to say about them. There's fluoxetine, paroxetine, sertraline, citalopram, and escitalopram. It's Prozac, Paxil, Zoloft, Celexa, and Lexapro. The first SSRI is fluoxetine, and there's just the other 4. We just need to know that they're SSRIs and that it's going to take 4 to 6 weeks for a patient to see any effects from it. SNRIs include venlafaxine and dofloxacin. Again, I don't know how to say it. Effexor and Cymbalta. The duofloxacin can help with diabetic neuropathy pain as well as fibromyalgia. For miscellaneous drugs over here, we have trazodone and bupropion, as well as mirtazapine. I hope that's how you say it. Trazodone is Dicerel or Oleptopro. Buperon is Wellbutrin, and mirtazapine is Remeron. This drug can help with sleep and can induce a strong sedation effect. Buperon is there's another brand other than Wellbutrin that's called Zyban that can help with smoking cessation. And mirtazapine, however you say it, can be given at bedtime for sedation. It reduces sexual dysfunction from other SSRIs over here, and it can be used as an appetite stimulant. For antidepressants in general, adverse effects include insomnia, weight gain, sexual dysfunction, serotonin syndrome, and all antidepressants are highly protein bound, so you need to monitor liver levels in your patient. Serotonin syndrome, which we've talked about here because it's an adverse effect, includes delirium, tachycardia, hyperreflexia, shivering, agitation, sweating, muscle spasms, and tremors. And severe serotonin syndrome or severe side effects or adverse effects from serotonin syndrome include hyperthermia, seizures, renal failure, rhabdomyolysis, I can't say it, dysrhythmias, and DIC, which is disseminated intravascular coagulation. So those are the antidepressants that we talked about here. I'm going to bring it closer so you can either screenshot it or pause it or whatever. Hopefully you can see this. and we'll get on to the next topic soon.